Greetings. This is Justin Allen with the Elite Nurse Practitioner. This is the Clinical Psychiatry for the Nurse Practitioner Course. This is the Elite Nurse Practitioner Guide on teaching non-psych nurse practitioners on how to evaluate and treat the most common psych conditions within your scope. And it is a solid review for the established or new grad Psych NP. I'm really excited about releasing this course. There is so much information in this course. I really think that all of you will derive a significant amount of value out of it. We are releasing two courses. We are releasing this Clinical Psychiatry course, and we are also releasing the How to Start a Psych Practice course, right? You can bundle both of them if you want the clinical knowledge and the business knowledge, or you can just purchase one or the other. So for the established Psych NP out there, maybe you just need the How to Open a Psych Practice course, right? If you're established Psych NP, maybe that's the only course you need. If you're maybe a new grad Psych NP, maybe you would need to bundle this course with the business course. Or if you are just a family nurse practitioner and want to know a little bit more about psychiatric care and maybe know how to treat various different depressive anxiety conditions and that sort of thing in your practice, then this is the course that you would need, all right? So there's two courses, and then there's going to be a bundle of both courses. But this is just the clinical course, and I think that a lot of nurse practitioners out there will really enjoy this, as there is so much information. Nicholas did a fantastic job collaborating with me on this. He is a wealth of knowledge. So let's go ahead and get started. So authors, I am Justin Allen, family nurse practitioner. I'm owner operator of the Elite Nurse Practitioner. I own 2 men's health practices, and I also own a medical cannabis clinic. I went from $0 to over $70,000 a month in revenue in less than 3 years through my practices. And we are providing hormone replacement therapy, IV infusion, weight loss services predominantly, but we also do a little bit of some, basic primary care and that sort of stuff. So yeah, I've created multiple practices and we are very successful. And it is a pleasure to share my knowledge with my nurse practitioner sisters and brothers so you guys can break free as well. And then there's Nicholas Goodwin. He is a DNP and also a Psych NP. He is owner-operator of Goodwin Health Cafe. It's a private practice psychiatric clinic, and he's passionate about providing mental health services to his community. He is a fantastic Psych NP, and he's going to be covering the clinical components of psychiatric care in this course. He is a wealth of knowledge. There are multiple hours of his wealth of knowledge teaching you guys general basic psych. So even for the established Psych NPs out there, I think you will gain a lot out of learning from Nick. So what this course provides. Our aim is to provide non-psych certified providers the essential knowledge to treat common psych conditions that fall within their scope and know when to refer out to higher levels of care. General mental health falls within the scope of general medicine, basic general care. Verify it with any board of nursing. I've called multiple boards of nursing. I personally provide very basic mental health services in my practice, right? If someone needs treatment for their anxiety or their depression, for example, right? I have no problem prescribing someone an SSRI or Wellbutrin, all right? Been doing it for over 10 years without an issue. General mental health falls within primary care. It really does. And general mental health is covered in most nurse practitioner programs. So you can justify providing very basic mental health services, all right? We are not talking about providing advanced care, making advanced diagnoses, all right? Our goal here is not to step on the toes of our Psych NP colleagues, right? That is not our goal here. We want to provide the foundational knowledge of general psych to our nurse practitioner colleagues so they can be well-rounded providers and understand how to diagnose and treat basic mental health conditions appropriately and effectively. This will improve patient outcomes overall. I don't know how you could argue it couldn't. And like I said, our goal is not to replace the Psych NP. That is not our goal with this course, okay? Quite the opposite. This knowledge will help assist the general nurse practitioner to make the appropriate diagnosis and begin appropriate treatment for basic mental health conditions. So when the patient is referred, they have been started on the appropriate intervention. We are not trying to replace the Psych NP. I just want to get that out there because some Psych NPs might not like what we're doing here with this course, but I feel like it's an appropriate course. It's a very standard foundational psychiatric course for the nurse practitioner. Now, course topics. We're going to talk about mood disorder diagnosis, understanding how to differentiate major depressive and bipolar illnesses. We're going to talk about depression, intervention, and psychopharmacology. We're going to talk about third and fourth line interventions for depression treatments. We are not trying to replace the Psych NP's knowledge or skill. That's not what we're doing. We're just enlightening our general nurse practitioner colleagues on what those interventions are. We're going to have an overview of antipsychotic treatments. Again, we're not going to teach you how to manage and prescribe antipsychotics. We're just going to go over an overview so you walk away more empowered with knowing what these meds do. We're going to talk about anxiety disorder diagnosis and intervention. So general anxiety disorder, panic disorder, social anxiety, PTSD. We're going to talk about ADHD diagnosis and intervention. We're going to talk about suicide assessment and intervention. Any patient walking through the door of your practice who is suicidal, you need to know what to do. Okay, we're talking about insomnia assessment and intervention. So many people suffer from insomnia. I mean, I've suffered from it myself, right? So it's good to know what to do. We're also going to talk about some basic documentation essentials, right? Just how to document a basic mental health visit. So those are going to be the course topics. And there are almost 6 hours of lecture here. Okay, so you're going to walk away with a lot of information and a lot of knowledge. So what is psychiatric care? Psychiatry is a branch of advanced practice that is focused on the diagnosis, the treatment, and prevention of mental, emotional, and behavioral disorders. So diagnosis and evaluation can be both verbal and physical. So there's obviously going to be the interviewing process, but you can also need to do lab work and stuff. You need to make sure you rule out organic causes of mental illness. Treatment can be based around psychopharmaceuticals, alternative treatment options. Sometimes dialing in someone's hormones, for example, can treat their mental health problems. So why provide psychiatric care in your practice? So why should you even bother knowing this information? Well, first and foremost, it's in demand and patients need help. You are going to see patients walk through your door. It doesn't matter what you do, right? You are going to have patients walk through the door that are going to have some sort of mental health problem, right? You are just going to. It is within the scope of the family nurse practitioner, the adult nurse practitioner, the adult geriatric nurse practitioner, the acute care nurse practitioner, and the pediatric nurse practitioner to provide basic psychiatric care. We are not treating advanced psychiatric illnesses here. That is not what we are doing. That is for the Psych NPs. That is for our colleagues. They are the specialists with that, all right? So it is within the scope of the nurse practitioner. Treat, diagnose basic mental health problems, all right? It's covered in almost every single nurse practitioner program out there. And so therefore it is within your scope. Most patients will suffer from a mental illness at some point in their life, all right? Most people will. Most people will have anxiety or depression or trouble sleeping or something some point in their life, all right? It's part of the human condition. It's a little overhead. I mean, integrating psychiatric care or just treating some patients who might have anxiety or depression in your practice, it requires very, very little overhead, okay? There's a very low barrier of entry to it. You can implement general psychiatric care into your practice immediately, right? You can take this course and start seeing patients for anxiety and depression. Like I said, you are not treating advanced illnesses. You are not doing that. Just very, very general basic psych care. And this is an essential service to provide to improve the well-being of your patients. I mean, most people will suffer from a mental illness at some point in their life. So therefore, you really need to know the basics and the foundations of this, right? And it can also help with the potentially long wait times in psychiatric practices. I mean, I know there are some places in this country where getting a visit with a psych practice can take 2 months. So this person should just continue to suffer for 2 more months? I don't think that's right. So yeah, it can help with long wait times as well if you understand foundations and the basics. Treating common conditions falls within the scope of most nurse practitioners. But remember, your Psych NP brothers and sisters are the experts. So therefore, know when to refer complex cases, serious disease, and treatment-resistant disease. We're going to talk about that in this course as well. So I hope you guys enjoy the lecture. Grab yourself a bottle of water or two and pace yourself and enjoy the lecture. I will circle back towards the end of the course to wrap it up. Thanks.